Welcome to the Pomelo Health webinar. My name is Kudsia Shaheen. I'm a senior program manager at TELUS, and we'll be showing you the Pomelo platform today, where we hope you'll enjoy the presentation. So now is the time for the exciting demo, and we'll just show you the patient view of things and a little bit of what the clinic sees as well. So here we are, logged in as Neo, who's our test patient for today, and he's a patient at a clinic called MA Sandbox. This stands for MedAccess Sandbox, and it's a pretend fake clinic, as you can imagine. Neo himself is a pretend fake patient as well, and we are in our stage or demo environment today, so if you see anything that looks a little bit finicky or is acting a little bit strange, that's probably why, because our wonderful product and development team is in here developing new features and fixing things. This is our MA Sandbox clinic, but this is not specific to MedAccess. So we'll speak about integration both in regards to MedAccess and PS Suite throughout the presentation. So let's start with everyone's favorite feature, e-booking. Within Pomelo, you've got lots of additional customizability options to really cater to your needs. So before I even get started as the patient, I want to point out that e-booking in Pomelo is customizable on several levels. So that includes at the very top, your clinic or practice level, and then specifically for certain providers or doctors or nurses, other team members, and then even certain appointments with certain providers. And then further down, you could even customize things for patients booking certain appointments with certain providers. So that'll all make a little bit more sense once I show you a little bit more about e-booking. So patients have a few entry points in regards to e-booking. You can see there's a tab up top here. There's a section right here. And you've noticed that we're logged in as Neo. So Neo has an email and a password that he can use to log into this clinic's Pomelo. However, that's not necessary. So you can also, let's say, just stick a link up on your clinic website, and anybody with that link could go to that URL and book an appointment with you through Pomelo. It's entirely up to you to decide who is able to book what, when, and how. Let's say you might just want to have patients who have their charts at your practice be able to book. You can limit it to just those individuals. And then the most controlled level is what you're seeing here, where a patient has to have an email and a password to log in. Now, just because Neo has an email and a password doesn't mean that he always has to log in to book an appointment. He could still go to that open public link on your website and book an appointment that's publicly available there. So for now, we'll go ahead and book an appointment for Neo, or as you can see on the screen, he could book the appointment for his baby or his older adult dad robot. And depending on the patient that I select here, different things will be available to me. So if I select my baby or my child, you'll see that there are a few groupings of appointments. By the way, what you see on your screen, again, entirely customizable. And within the regular and office appointment group, you'll see that there's a well baby available to the child. Whereas let's say if I went back and selected robot as a patient, robot is diabetic. So he's got a diabetes program available to him with a diabetes consultation. Whereas I, Neo, am part of the smoking cessation program. So for me, under preventative care here, I'll see a smoking cessation. And this, for example, is booked with a nurse at my practice. So let's say your regular or your urgent appointment is with a family physician or your GP, whereas this appointment is with a nurse. We can absolutely set that up. So we'll go back and show you a couple other appointments. Let's say if there's, something urgent that I want to book. Let's see if there are any availabilities open for an urgent same-day appointment. And of course, what appointments you make available for which doctors can differ, is customizable, is entirely up to you to decide. So you can see there's an urgent appointment, and this might be something that's available with any physician at the clinic, regardless of who your primary physician is, and patients just select a time. So you could even set something up like that. And patients can then either choose the very first option or view everything that's open to them. Again, up to you to decide how far out they see something. So urgent appointments, generally are going to be available only the same day or the day after, maybe 2 or 3 days in advance, and that's it. Whereas let's say, another appointment, which I'll show you in a minute, could be available a month out. So we'll select just whatever time here, and you can see that there are reasons that patients can be facilitated to select during the booking process. Again, customizable. You choose how many and what they say. And let's say in this case, the patient says they're dizzy and they can't breathe and they're having chest pain. If they select that, we can actually block the booking request and let them know, XYZ instructions that's a customizable alert. Whereas let's say if I went back and selected a mental health appointment for myself, you can see that that's with my primary physician who works out of 2 locations. So you can see in this setup, we have multiple locations that can be supported as well. And let's say we'll just select location 1 and the closest availability, which is tomorrow. And you can see that in regards to the mental health, one of the places where e-forms might really help and be useful for your patients is e-booking. So with this mental health, this clinic has attached a general anxiety disorder form that the patient can complete. And this is just one of the places where we'll just go ahead and do this now as our pretend neo patient. But this is one of the places where you could use e-forms with your Pomelo platform. You could also attach it to appointments reminders or the check-in process, or just send it on a one-time basis to a patient, just as a, hey, this is this one time, you've got to fill out this form, and we'll send them an email letting them know, hey, you've got to fill out a form, here's a link to it, or they could log in if they have a password to do so in the portal as well. And then here you can see we've just got a generic box for the patient to provide any additional details or a reason. This could be mandatory or optional, again, up to you to customize. We'll include something here and submit a request for the appointment. And that's it for the patient to ebook. You'll notice that there's a little note that lets them know this appointment is awaiting review by clinic staff. So that's an optional feature that you can use, again, customizable on a per appointment, per schedule level that allows you to triage an appointment type being booked before the patients receive a confirmation. And in regards to appointments, something that a lot of our clients find really helpful is, let's say if a provider is sick for a day and they have appointments scheduled for the entire day, instead of you having to call every patient on the phone, you could go to the provider side of the portal and cancel those appointments on a one-time basis and send the patients a custom message letting them know, hey, the doctor is sick today, we'll call you to reschedule, or you go to the portal and rebook your appointment. So that's super useful because it'll save, we've heard lots of feedback from clients that it's saved them lots of phone time. And decreased phone time is a great segue into the next feature, which is reminders. So with appointments, you've got automated reminders that can be done via email, SMS, or voice calls. And they are, again, customizable at a clinic, schedule, and an appointment type level. So patients can be requested to confirm their appointments through reminders, and they could also be allowed to cancel appointments through their reminders if you choose so. And this could be specific for different appointments. And you decide when the reminders go out. The default in the system is 2 days, but you can change that on a per schedule or provider basis. And of course, as I mentioned, you can attach forms along with the reminder. So similar to how we booked that mental health appointment just now, when the reminder for it goes out, it could also have the form attached to that in case you wanted the patient to fill it out just a couple of days before they came in. And soon we're also we're working on this, and it's coming soon. We'll also be able to send customizable voice reminders to your patients. But at this point, the email and the SMS can be customized with lots of details. And of course, when the patient does confirm an appointment through their reminder, so that might look something like this. We're logged in as Neo in his Gmail inbox. Here's a reminder. You can see it's got some details included at the top, some basics. And this is, a diabetes consultation reminder for Neo's dad robot. So there's custom instructions to bring their food log, and Neo can click on this button here to confirm. Oh, That's one of the examples of why things are funny in state sometimes. So when we click this button here, it'll confirm the appointment and will show you the confirmation in MedAccess via a confirmed status, and in PS Suite via a green sphere, like a little green circle. I'm sure you guys know what that looks like. So that's it in regards to reminders. Next up, we have private messaging. So again, as you can imagine, throughout the pandemic and just even in general, the ability for clinics to communicate with their patients through private messaging as opposed to having to call anytime there's a question is super useful. It helps patients feel a little bit more autonomous with their care, more engaged, and really helps save valuable time for the care team. So in terms of messaging, by default, private messaging is turned off from the patients to the clinic, but it's always enabled for anybody at the clinic to reach out to a patient. And you can adjust those defaults on a default basis or on a per conversation basis. So as Neo here, let's say if we went to his mailbox and compose a new message, similar to how he can book an appointment for a patient, he can send a message on behalf of his baby or his child or his older adult diabetic robot dad. And if I select robot, you'll see the diabetes education program appears. Whereas if I select me, I only see these options. So with messaging, you can make it so that only groups are able to receive messages like receptionists, and this could be a shared inbox, or let's say if a particular doctor or another provider wants to be able to receive messages directly, for example, Dr. 2 here, we can do that too. Again, up to you to decide. And you can include messaging within the portal itself to guide your patients about how to use the feature. And let's say if I were to select medical reception here, there's additional information specific to this recipient that you can include within the portal. And that's it. So the patient would just include a subject and a message itself and send it away. And if you allow them to, they can attach a file as well. Again, this can be customized on a clinic or a provider specific level, and then you can override it specifically for each individual conversation too. So let's show you what messaging looks like on the provider side of things now. So here we are on the clinic side of things, and I'm logged in as an MOA. And you can see that here in our inbox, we've got a new message regarding the child that Neo cares for about vaccines. And you can see that the patient is asking a question. And at this point, if I know the answer as somebody who's part of reception, I can send it away to the patient and, of course, download the conversation to their chart. I can close off the conversation by unchecking this so he can't respond, or if there is a need for back and forth, leave this on. But let's say, a lot of times what clinics might do is have the patients be able to reach out to reception, and then reception triages these incoming inquiries. And let's say if this is a question or an inquiry that pertains to a doctor, I can assign it to the doctor. So the doctor doesn't get the message directly from the patient, but it goes to the receptionists first. So in this case, let's say that the doctor is Dr. Thompson here. I can select him, include comments along with that, assign, and of course, the patient will not see these comments, but when you do download this conversation to their PS or MedAccess chart, it will log as an internal note. And you have a couple neat features that I'd like to show you in regards to messaging. This applies whether you're responding to a message, as we're doing here, or writing a new message to a patient. You can set yourself to be notified if the patient doesn't read your message in X amount of days. The default, as you can see in the system, is a week, but you can change that on default basis or on a per conversation basis. Similarly, as I mentioned, you can allow a response just for this one time or turn it off for just this one time. And if this is something that's a little bit pertinent and important that the patient responds to you, you could even request a response from them. And that allows you to set a number of days within which you would like the patient to get back to you. And if they don't, after 3 days or whatever I include here, for example, 7, the Pomelo portal will send Neo a message saying, hey, there was a conversation about your baby's vaccines. You were supposed to respond. You never did. Your response was due 7 days ago. And that's it. And of course, if you'd like, you can allow the patient to attach files within this conversation specifically as well. And of course, within eForms, another place that can be included is within a secure message. So let's say if you wanted to include, a PHQ-9 or any questions, you can see we've got some test forms in this test clinic that could be included along with a message itself. And you could go ahead, let's say the question was when the baby will need their next vaccine appointment. And let's say if we want to say something like, we'll reach out to you next week. Have a great day. So we'll respond, we'll end the conversation, we'll download it to the child's chart. And that's it in regards to messaging from the clinic side. And this is on an individual level. So you can imagine that throughout the pandemic, to be able to reach out to patients on a group basis has been super helpful as well. So on an individual level, you would use private messaging, but let's say if you wanted to reach out to your entire panel of patients for a particular doctor or the whole clinic, or just those patients who have diabetes or are due for their colorectal screening, you can do that through the broadcast or group communication feature. So you've got 3 options at your practice. The first is an email. So that includes just things that are regular office alerts, policy changes, a doctor going on vacation, you've got a new NP who's joined the team. That could be something that's a regular email, like a newsletter. Then you've got a private notification, and that could be used for something that has some health information attached to it. So let's say there's a medication that's been recalled, or that colorectal screening that somebody's due for. You could have a group of patients that you pull from your MedAccess or PS Suite and just send that colorectal screening is due notification to those groups. Or, as I mentioned, it's really up to you to decide how you group patients and what they see through group communication. And then your last option is a portal broadcast. This is information that displays within the patient's portal itself. So if we go back to Neo's portal here, he's logged in. As you can see on his homepage, he's got a flu shot clinic broadcast, which is going to come into effect in just a few months. And then there are some COVID-related clinic changes that the clinic's explaining here. You've got just information about COVID-19, and as you can see, you can include links, images, tags. So this is all HTML formatable for those of you who might know. So you can include whatever you'd like in there. And of course, our team is here to help you as well. And that's it in regards to broadcasts. We are working on doing broadcasts via SMS as well. So that's coming soon. And stay tuned. And of course, the last thing I want to mention is in regards to broadcast and group communications, you can see engagement analytics within your clinic's provider side of the portal to see, let's say, who opened the broadcast, and who was able to view it. Awesome. So next up on our features list is the self check-in. So as you can imagine, that's super helpful as well. We actually can have patients check in for their appointments that are in person at the office using their own devices. So there's no special hardware requirements, no kiosk for you to update, upkeep and clean, where we're really encouraging patients to check in for their appointments on their own phones. And how that happens is we can send them an email the day of the appointment, just a little bit before their appointment time, or they can scan a QR code or go to a URL that allows them to check in. So for the purpose of the demo today, we'll show you what this QR code might look like. And actually, I'll show you what it looks like on the clinic side. So here we are again as an MOA, and you've got a check-in quick link at the bottom of your dashboard. And here's Dr. One's check-in instructions for today. So this little printout might be placed at your clinic door or on a pole in the parking lot, wherever you'd like. and you could scan this QR code and check in for your appointment. Or if somebody doesn't know how to do that or their phone can't do that, they could go to the URL that's here. So let's go ahead and we'll go to the URL. And you'll notice that there's a code here that that allows patients to confirm whether they're present at the clinic or not. So you'll see how we use that in just a second. So we'll go back to our patient view and go to the URL. So this is the equivalent of somebody scanning the QR code. And you can see there is, again, custom messages that you can use here. So here's a title, a description, and because I'm just going to a URL, I have to let the system know who I am. So for today, we're Neo. His last name is Reeves. If there are any Matrix fans over here, shout out to you. 1999, September 9th. But if this was an incorrect birthday, the system would let me know, hey, we can't find your profile. Please check your information that you've input. So we'll go ahead and check in. It's very similar to checking in for an appointment in person. So let's say the patient walks in to the reception, your receptionist would ask whether your address and your email and your phone number is the same, and that would exactly be the case in a self check-in via Pomelo as well. So the patient would give you their information, and we find the appointment in the system for them. They can then confirm during the check-in process whether their information has changed or not, and moving forward, they could fill out a form, for example, a COVID-19 screener that might be part of that process, and then complete check-in. And of course, via integration with MedAccess and PS Suite, will let you know that the patient's checked in MedAccess by updating the appointment status to checked in MedAccess. And there's a little upwards arrow that indicates this in PS Suite. And I'll show you in terms of what the check-in email might look like. So let's see here. In terms of the patient, as I mentioned, there's a few ways for them to check in. So here we are back up on the screen. You'll see that there is a check-in email from MedAccess Sandbox. So in just about a half hour, we have an appointment, and this is the check-in email for that appointment. Awesome. So I think that's about it for the main features of Pomelo. We alluded to e-forms a little bit. I want to just bring our attention back to that in regards to the fact that it could be attached to, as I mentioned, the check-in process. But one thing that I wanted to mention is that they do have, e-forms have logic built into them. So let's say, if you have particular questions that the patient might answer, and then the questions can be scored to calculate a severity score, for example, in a PHQ-9 or a GAD-7, we can do that. Or let's say if a patient is answering a question and that that is supposed to, let's see if we can show you that as well. And that's supposed to bring about other questions. So here there's a form that lets you know, hey, how are you feeling today? Or asks you how you're feeling today. And you can see it's a one-time link that the patient's received in their inbox. And this patient doesn't have to log in to fill out this form. We've connected this individual to their chart, and he can fill out the questionnaire on his phone or on his computer, wherever he is. So let's say if the patient says, hey, I'm feeling sad today, we can have a message pop up in response to that. And then let's say we ask them how good or sad. If he says 1, okay, well, that's not too bad. And then you can have you can have specific questions that allow patients to input answers via different methods. For example, this is just a comment box here, whereas you might have a drop down or lots of options for somebody to choose from. So lots of possibilities there for your patients. Awesome. So you'll see an email on your screen there. If you'd like to know more about pricing or just have any other questions in regards to the platform, feel free to reach out to telussales.emrs@telus.com, and our team would be happy to assist.